Okay, why don't we go ahead and get started? Greetings to everyone from Seattle. On behalf of the Northwest Mental Health Technology Transfer Center, we welcome you to today's webinar, Psychological First Aid, Increasing Resiliency During COVID-19, with Doctors Michelle Bedard-Gilligan and Emily Dworkin. We're really grateful to all of you for joining us today and learning more about this topic. It's one that we see as particularly relevant during these challenging times. We look forward to sharing information, tips, and guidance, and to having an exchange among all of us today. My name is Maria Monroe DeVita, and I am the co-director of the Northwest MHTTC. Let's start just briefly with a little introduction to the Northwest MHTTC. The MHTTC is a nationwide network that is supported by the Substance Abuse and Mental Health Services Administration with the purpose of disseminating and implementing evidence-based practices for mental health disorders within the behavioral health workforce. The Northwest MHTTC is based at the University of Washington in the Department of Psychiatry and Behavioral Sciences. We provide training and technical assistance and evidence-based practices to Region 10. That includes Alaska, Idaho, Oregon, and Washington. Broadly, our goals at the Northwest MHTTC are to ensure availability and delivery of free, publicly available training and technical assistance to Region 10 providers, heighten awareness, knowledge, and skills of the workforce addressing the needs of individuals with mental illness, accelerate adoption and implementation of mental health-related EVPs across Region 10, and foster alliances among culturally diverse mental health providers, policymakers, family members, and individuals receiving services. So briefly, let's talk a little bit about language. It is our intention to always be mindful using language that promotes recovery and culturally appropriate terminology. We encourage everyone to use and champion for person-first language, which emphasizes the individual, not the condition or diagnosis. Person-first language is a way to demonstrate respect for a person's dignity and worth. It is consistent with recovery-oriented practices and promotes service environments that foster respect, human dignity, and hope. Now, let's just do a couple of polls just to see kind of who is in the room, so to speak. So the first question is to tell us who you are. We have about 10 different categories, and so select the one that best fits for you. And let's see, we've got so far a number of responses coming in. Looks like many of you are in the behavioral health workforce as managers or leaders. And then secondly, school system or school-related leaders. So we'll give you a little bit more time. We're at about 60% of you have voted so far. And a number of you are also from other kinds of agencies as program administrators, directors, or leaders. So a little longer here, make sure we get a critical mass so we can tailor to our responses and know who's in the audience. And so it looks like we've got about a third of you are behavioral health supervisors, managers, or leaders. And then another almost 20% are school system or school-related leaders. And 14% are other agency or other program administrators, directors, or leaders. And then we have a range of other folks on the call. So you'll want to click on that top right-hand corner to close out the poll in front of you. And then we'll go to our second poll just to get a sense of the service setting that you're working in. So the next question relates to your typical service setting. And we say typical primary work setting because we know that many of you are actually at home right now. So we don't mean that, but where are you typically sitting and working? So go ahead and put in your responses here. Got a decent number of you who are saying educational settings. So these very much align with kind of the roles that you're indicating. Behavioral health clinics and treatment programs seem to be next. We'll see how that plays out in the final voting. We've got about 70% of you who have voted so far. Thank you. All right, so it looks like about a quarter of you are from educational settings, another 16% behavioral health clinics or treatment programs, another 10% outpatient healthcare centers, 8% peer-run programs. And then a mix across a number of other settings. So thank you. You can just click that box in the top right-hand corner then to see the rest of the slides. So now the most important part. I am really pleased and honored to introduce our two presenters today, Michelle Bedard-Gilligan and Emily Dworkin. Dr. Michelle Bedard-Gilligan is an associate professor in the University of Washington Department of Psychiatry and Behavioral Sciences and the co-director of the Trauma Recovery Innovations Program. Her program of research focuses on understanding response to traumatic events with a focus on alcohol and substance misuse, and on building and testing interventions designed to promote recovery following trauma exposure. She is also a licensed clinical psychologist and maintains an active clinical practice. Dr. Emily R. Dworkin is a licensed clinical psychologist and an acting assistant professor at the University of Washington School of Medicine. Her research focuses on trauma recovery with a focus on identifying strategies to promote resilience and understanding the role of social relationships in post-trauma outcomes. And so now I will turn the presentation over to Emily and Michelle.
Thank you. So I'm going to start us off. Like Maria said, my name is Michelle Bedard-Gilligan, and I'm a clinical psychologist in the state of Washington and faculty at University of Washington. And I'm really excited to be here. I want to thank everyone for attending. I know that this is a really busy time for many of us, and I really appreciate you making the time to attend this webinar and taking an interest in this topic. We are going to be talking a bit about psychological first aid, which is an approach for managing reactions in the sort of immediate aftermath or even during an acute crisis, such as what we're going through with COVID-19. So first I'm going to start with just a few acknowledgements. So I want to make sure I acknowledge and give credit to the numerous organizations from which the material we're presenting today is based. So psychological first aid is an approach that was first developed, it first really took off, I would say, in the aftermath of 9/11. So in the aftermath of the terrorist attacks on September 11th, the psychological first aid became an approach that was started to be very widely used. And it was really developed and put out by a number of organizations to which we have to give credit. It's free, public domain approach, and it's been adapted and developed by the World Health Organization, who has a guide out for psychological first aid more generally, and then also a guide that's available for psychological first aid as it pertains directly to the pandemic, to a pandemic type experience, and it was put out after the Ebola outbreak. In addition, the National Center for PTSD and the National Child Traumatic Stress Network has a PFA manual that they developed as well, and the materials that we're presenting today are based off of these manuals. In addition, our colleague, Dr. Deborah Kaysen, who's now down at Stanford University, helped with the development of these slides, and so we want to make sure we give her credit as well. And then finally, we want to thank the individuals and organizations that are really enabling us to do this work and to disseminate knowledge on PFA as an approach to acute stressors. So the University of Washington Department of Psychiatry and Behavioral Sciences, which has supported Emily and I in this work, as well as our colleagues who comprise the University of Washington COVID-19 Mental Health Working Group. We are a group of social workers and psychologists and psychiatrists who are meeting regularly to talk about what we can do to get resources and help out to community members who might need it in the mental health realm. And then finally, we want to thank the faculty and the staff at the Northwest Mental Health Technology and Transfer Center for inviting us in and for supporting us in this work and giving us feedback to help shape this presentation, as well as SAMHSA, who's providing funding for us to be here. So thank you so much to all of the, it takes a village, and we want to make sure we acknowledge that village. So our objectives today, so this is a training or a webinar that we are gearing towards leaders and managers. And so what our goal is today is really to provide an overview of psychological first aid, which we'll often call PFA as for short. We want to provide an overview of PFA approach and highlight the key elements of PFA. We want to talk a little bit about what PFA is and when it's used and how it's used. But we also want to talk about what are the specific elements of PFA that can be used by people in leadership. So often the people in leadership are the people who are supporting the people who are working with those who are kind of most directly exposed or most directly affected. And so we think that there's elements of PFA, techniques in PFA that really can be pulled and put into practice in the work that leaders and managers are doing. to kind of support the workforce kind of more generally. So we're going to put an emphasis on how we can use strategies inherent in PFA in a leadership type role. And we think that there's several elements of PFA that can really serve as a framework for how behavioral health managers and leaders can support their staff during moments of high stress and crisis. For example, elements of PFA that are really around how we respond to in the moment distress. So a lot of us are seeing more acute distress reactions or difficulties in functioning in the people that are working for us or with us. And so strategies about how we respond to that, as well as strategies around how we can support our workforce if they need extra help. So ways that we can make referrals, promote engagement in services, or even promote some active coping skills for individuals who might be struggling who are working with us. And the webinar is really broken down into sort of some key aspects of how defining and describing psychological first aid. So we're going to present the PFA model with a focus on the why. So why it is that we think something like PFA is needed during a crisis like COVID-19. We're going to talk about what PFA is, and then also a bit about what it is not. And then we're going to talk about when to deliver PFA, who is most likely to benefit, and then we're going to spend a bunch of time talking about how. So how you do PFA and how it is best implemented. And then finally, as I mentioned, we're going to talk a bit about how we can adapt it to fit a manager or leader context and role specifically. So let's start with the why. So why PFA, and why do we think that something like PFA is needed during a crisis like COVID-19? And to really talk about that, first we need to talk about the process of resilience. And resilience we define as the process of adapting well in the face of significant adversity or significant sources of stress. So resilience really is this idea of being able to adapt and continue to function and move forward despite setbacks and despite really significant experiences of stress or adversity. And it's really important that we talk about the fact that resilience is actually ordinary. We don't think of it as an extraordinary construct. And what I mean by that is that resilience is extremely common and typical. So for most of us, resilience will be the path that we will follow, even after we've been exposed to extreme stressors or difficulties. Humans are sort of innately programmed to be resilient, to sustain losses, to sustain stress, to sustain setbacks, and to continue to keep moving and striving and kind of going forward. And we know this because we see this repeatedly, even after exposure to kind of the most traumatic stressors there are, we see that most people really do follow a resilience pathway. And that can sound surprising to people, but I think it's important to remember that when we say resilience, that does not mean the absence of difficulty or distress. So resilience does not mean that people don't struggle. It doesn't mean that things don't feel hard. It doesn't even mean that people don't experience distress reactions or symptoms of distress that are not typical for them. It just means that they are able to sort of meet those experiences in a way that enables them to keep moving forward and keep adapting. And so we really think of resilience as that ability to persevere. And it's not a trait. It's not that there are people who are resilient and people who are not. We think of resilience as something that can be learned and acquired. And it isn't something that you just have. Resilience takes a lot of effort. Resilience is work. It is something that we have to strive at to continue to move forward and cope adaptively and function despite the setbacks. But we can learn strategies and ways to do that that can make it easier and can make it more likely that resilience is the pathway that we follow. And there is no one path to resiliency. So it doesn't always look the same for any given individual. And so we sometimes think of resiliency as this sort of straight line, like something terrible happens to us and we rise to the occasion and we follow a straight line of coping or kind of movement forward. And unfortunately, particularly during something like COVID-19, where there's a lot of ups and downs and it's really a chronic stressor that's superimposed by these these moments of acute stress, that's unlikely what we're going to see. We're going to see good days, we're going to see bad days, we're going to see more of a jigsaw pattern of what resiliency might look like. And there are going to be setbacks, and there are going to be times where things feel really hard. But on the whole, most of us are going to end up kind of adapting continuously. Maybe many times in a given day, we're going to be adapting to new circumstances, but we're going to be doing so in a way that enables us to keep going, adapt effectively, and keep moving forward. And that's the expected. I mean, that's what we expect to see. And I think it's really important that we remember that, because as we talk about PFA, you're going to hear us talking about the different skills and techniques that we use. But really, we need to do so with this mindset that some amount of short-term distress, some amount of acute reactions is absolutely expected, and doesn't necessarily mean that someone's on the wrong path, and doesn't necessarily mean that they're not going to be resilient in the long term. Okay. Oop. Sorry, my slides wouldn't advance and then they went way too many at once. So let me go back up. And that, with that, I think, we do expect to see some acute reactions. So we do expect to see some negative reactions to the stressful circumstances that we're all living through right now. And some of the things that we do expect to see are things around emotions. So we expect to see elevated rates of things like fear and anxiety, anger, guilt, sadness, and grief. We can think about those things as being really heightened because of the crisis and the stress that we're all sort of enduring right now. In addition, we expect to see thoughts and behaviors that are impacted by the stressful circumstances that we're living in. So things like worry, thoughts about self-blame or feeling like we're not doing enough, ruminating or getting stuck on things, as well as behaviors such as avoiding, pulling back, isolating, or a lot of reassurance seeking or checking. Media is a really great example of that, where a lot of us may find ourselves turning to media or news sources more than normal to try to find out what's going on and kind of feel some semblance of control about what's going on in our environment, given that things are feeling more out of control than normal. And all of these kinds of things, these increased affect, these thoughts, these behaviors are somewhat expected. We expect to see these negative reactions to stress. And in and of themselves, they don't indicate a problem. These reactions to stress become problematic when they persist or when they start to impact our functioning. And ways that we might see COVID-19 specifically affect workers that are working in healthcare, and by healthcare we mean really general, so behavioral healthcare, school settings where we're providing healthcare support or mental health support. We expect to see things like increased workloads and increased stress, so things like potentially feeling more burned out or more burdened by work than normal. We might expect to see, depending on the work settings that we're in, a possible loss of coworkers, so either due to the illness or other factors such as furloughs or layoffs or those kinds of things. We might see more anxiety about coworkers and patients and their families, distress around having to make decisions, how we prioritize care and make decisions about our own safety, about when is it safe to sit in a room with a person, when is it safe to go into clinic, and balancing those kinds of things and feeling a lot of distress about really not knowing how to make those decisions, as well as more difficulty accessing social support and resources, both due to kind of social isolation, but also due to things being shut down, as well as having more burdens on our time. And so we can really, a number of ways where we can see COVID-19 particularly affecting those of us who are in sort of helping professions in particular ways. And so, we expect, like I said, we expect to see some of these effects, and we do expect to see some of these distress reactions. And in and of themselves, these reactions don't necessarily signify a problem. And the good news is that, what we do during the crisis matters a lot. So what we do when we see these reactions, how we handle those reactions, how other people respond to this acute distress that we might be experiencing, makes a big difference for who recovers, who follows a resilience trajectory versus who continues to struggle more long term. And that's where PFA comes in. So PFA really is considered a resilience building approach. So it is an approach that is designed to build resilience during and immediately after really stressful traumatic circumstances or traumatic events. And psychological first aid is best described as a humane, supportive response to somebody's suffering. So it really is predicated on this notion that intervening in a way that is kind and supportive and builds on strengths to increase resilience is the way to help somebody move forward despite the adversity that they're feeling. And so PFA is an acute intervention that's meant to reduce initial distress and set somebody on a path towards resiliency. So it's meant to be done in an acute setting and meant to be done in a very time-limited, contained way. PFA is evidence-informed. What we mean by that is although there are no kind of randomized clinical trials or other sort of direct data supporting PFA's efficacy, it is based on strategies from both things like cognitive behavioral therapy and more general emergency response literatures that have evidence behind them as being effective and really effective in promoting recovery for individuals. And so it's evidence-informed in that it's built on those principles, but it does not have any sort of direct RCT data supporting its efficaciousness currently. PFA is meant to increase both the sense of safety, connection, calmness, and hope that an individual is feeling, basically because the data suggests that these are some of the things that are really related to recovery following trauma. And so it's really based on trying to have the individual have initial experiences that convey these kinds of things around safety and connection and hope to help the individual move forward. It's also meant to practically help the individual increase access to support, because we know that support is predictive of long-term positive outcomes. And so helping an individual access the social, physical, and emotional supports that can help bolster them during the acute phase and really help them in the long term adjust as well as possible. And then finally, PFA puts a big emphasis on increasing self-efficacy. So it's really built on this notion that if in the acute phase of a stressor, we can help the individual increase their sense of being efficacious, increase their sense of having some control over their environment and their responses to it, that we will enable in them the ability to continue to do that as they move forward through the crisis. And so it's sort of about instilling this initial response that is based on increasing mastery and ability to cope effectively so that the individual can stay on that path even after, even as they move forward with the rest of the crisis or the aftermath of the crisis. And PFA differs from traditional treatment. So for many of us, particularly if we're in the behavioral health field, therapy can look a lot of different ways. And PFA is not therapy. It is not considered a therapy or an intervention approach or therapeutic intervention in the traditional sense of the word. It is resilience-based. So it is not meant to target psychopathology. It is meant to help the individual manage their reactions, their very expected reactions to an acute stressor in a way that helps them to cope as effectively as possible. But it's not meant to treat underlying psychopathology. And so it does not look like a standard therapy setting or structure. It is very structured and very direct and very contained in terms of exactly what the focus is. It is also not psychological debriefing. So for any of you who are familiar with psychological debriefing, that was an approach that was advocated by, I think, the Red Cross many years ago as an approach to responding to individuals after mass disasters and mass traumas. And generally it was found to not be helpful. In fact, for many people, it actually made things a little bit worse. And PFA differs from psychological debriefing in a lot of key ways, especially around individuals engaging in PFA being those who are seeking support, who are experiencing distress and looking for help, as opposed to psychological debriefing, which was mandated. It also is really predicated on this notion of giving people as many choices as possible and empowering the individual to take control of their own recovery, as opposed to psychological debriefing, which was done in a group format and was much more about mandating what was helpful for the person around processing a trauma memory and really reliving the emotions associated with the experience. And PFA does not take that approach. It differs quite substantially, as you'll see when we get to the how section of what exactly is included in PFA. Some of the general guidelines for individuals who are delivering PFA, operating within an organized response system is a big piece of PFA. So that might be a clinic or a healthcare system that somebody is embedded in. It might also be an emergency personnel setting or a school, but somewhere where both the individual seeking the PFA and the individual providing the PFA has support. A big piece of PFA is connecting people to resources and supports, and so having those available is a really crucial piece. Other guidelines around PFA have to do with remaining in the scope of your expertise, role, and training. So we are going to talk a little bit about, what might the elements of PFA that fit in the role of being a manager, right? For example, and that's very PFA consistent to figure out what are the techniques that fit in that specific role. And so really knowing your expertise and what you're there for and what you can provide the person in that moment that you're doing PFA. It's not therapy, but it puts an emphasis on confidentiality because, it is being delivered during an acute stressor, and we want individuals to feel empowered to share the experiences they're having, and so there is still an expectation of confidentiality. As I've mentioned a couple of times, PFA puts an emphasis on empowering the person to make their own decisions, and so it's around helping people to see their options and to make the most well-informed choices that they can, but really help guiding the individual to make those choices and empowering them to do so. Culturally sensitive and aware, so during a stressor like COVID-19, there's a lot of variability in how individuals and communities react to this kind of crisis, and recognizing how that might be shaped by culture and context is extremely important. And then also being able to make sure that you are taking care of yourself before you are delivering PFA or even thinking of using any of the strategies inherent in PFA. It's meant to be delivered in the midst of these acute stressors that are infecting entire communities. And so it's an expectation that the people delivering PFA are also going to be dealing with their own physical and emotional reactions. And so making sure you are taking care of those and tending to those before you try to help someone else is really crucial. It's that put your own oxygen mask on before you help others analogy, and it's really important here. And when is PFA meant to be delivered? So PFA, as I mentioned previously, is an approach that was developed to be implemented during or immediately after a mass disaster. So originally, like I said, things like 9/11, as well as earthquakes and other natural disasters, Hurricane Katrina, for example, terrorist attacks. Those are terrorist attacks or mass shootings. Those are some of the places where PFA has really been called upon to help entire communities that have been affected and in that really acute phase. It has also been tested in the midst of pandemics, so both SARS and Ebola. The responses to both of those past epidemics also included strategies inherent in PFA and included a PFA approach to helping communities manage their mental health needs. So PFA can be applied really broadly in diverse settings and in diverse contexts. So providers who are giving PFA do not necessarily need to have a mental health background. It is an approach that was designed specifically to be able to be implemented by a more diverse range of individuals, to get rid of that barrier around providers needing to have a certain type of training or expertise in order to help somebody in an acute crisis. And so you do not necessarily need to have that expertise. You do need to be trained in PFA. So you do need to understand what it's about and how to do it. And then, as I mentioned earlier, you do need to have met your own needs as well. Recipients of PFA are those who are expressing interest in it. So those looking for support and or stabilization during or immediately after the acute crisis. We also think of PFA as being particularly helpful for those who are at higher risk of developing negative outcomes, either due to their proximity to the crisis or to other risk factors that they might have. So we think of things like not having a lot of access to outside supports, or having a past history of either mental health problems or not coping quite so adaptively. These are things that can put people at risk. And so those are some of the individuals that we see as most vulnerable, who might benefit the most from something like PFA. And recipients can include healthcare workers, as well as patients and their families and their community members. So we are seeing a lot of acute distress reactions in many of the providers at University of Washington, for example. And we have been using PFA to help manage some of those reactions, because the individuals who are caring for, as I mentioned earlier, the individuals who are caring for people right now are taking a large burden on in terms of some of the stress associated with COVID-19. And so really thinking about individuals who might benefit from something like PFA. And so now I'm going to turn it over to Emily. She's going to talk about PFA and sort of how to do it more generally, and then also some of the, she's going to highlight some of the strategies that are most helpful potentially to individuals who are in leadership and manager roles. So I think I have to turn over control. So let me turn over control. Oh, I think maybe it's already done. Okay. I think you should be able to do the slides, Emily. Thank you.
Thank you, Michelle. I'm Emily Dworkin, and I'm going to be talking about the how of how you do PFA. So I'm going to explain sort of the concept of PFA and the strategies involved in PFA, and then talk a bit about how you would apply it to your role as a manager. So PFA is comprised of 8 what we call core actions that I'll be going into in more depth. And these core actions aren't necessarily sequential, meaning that you don't have to do them in order. And they're really flexible depending on what a given person is presenting to you with. So they're tailored based on a specific person's needs and concerns. And this is part of sort of, it's by design that they're like this, because this is happening during a disaster or ongoing crisis, when we might not be able to deliver them in the same way for every single person. But it's also consistent with PFA's general value for giving people what they are asking for and for what they need, rather than assuming what they need or, you know, giving a one-size-fits-all solution. So these are the 8 core actions. I'm going to go into them in more detail, but just briefly, they include contact and engagement, safety and comfort, stabilization, information gathering, practical assistance, links to social supports, information on coping, and links to services. And I'm going to be talking about these in groups, because we think that some of the kind of themes in some of these go well together. So I'm going to start by talking about contact and engagement and safety and comfort. And this is what you do when you're first having contact with somebody that's in distress related to COVID or whatever crisis is happening. And the idea with these core actions is to interface with the person in a way that helps to build rapport and also support and enhance that individual's sense of both emotional and physical safety. So kind of having a calming presence, you know, talking to them about what they need and want, using reflections, which I'll talk about later. But generally just using your good kind of clinical skills and your good listener skills to build that rapport and support their emotional and physical safety. And then in the context of COVID-19, some of the things that you might want to be especially mindful of is paying attention not just to the needs about safety and comfort for that individual. You know, as Michelle said, this was designed for natural disasters, so usually you'd be thinking about, you know, is that person physically safe in their environment? You know, is their environment structurally sound? But in the context of COVID-19, what we would want to be thinking about is not just concerns about that person's safety and well-being, but also the safety and well-being of their loved ones and patients and coworkers more broadly. The next PFA core action is stabilization, and the goal with this core action is to respond effectively when somebody is coming to you in kind of acute emotional distress, such that they're really emotionally overwhelmed or even disoriented. And I'll talk about specific strategies for addressing this in a bit, But part of what we want to emphasize is that not everybody that comes to you in distress is going to need stabilization. The idea here is to give tailored responses to people whose reactions are really intense and persistent. So they're really having strong distress reactions, or their distress reactions just haven't let up over a long period of time. And either it's getting in the way of their ability to function effectively, including their ability to cope with what's happening, but it could also be impacting their ability to protect their own safety or patient safety. So kind of a classic example of this in the healthcare setting would be somebody who's having panic attacks when they have to wear personal protective equipment. And for those people, they might need some more specific skills beyond just the general kind of good listening and troubleshooting skills that you'll see throughout PFA. The next PFA core actions are information gathering and practical assistance. And the idea with these core actions is to identify the immediate needs and concerns of the person that's coming to you. So this is essentially the assessment phase. And so you'd want to gather information and ask questions about what's going on for them, what their needs are, what their concerns are, what they're worried might happen, and then help them prioritize what those needs and concerns are. So which one is the one that most needs attention right away, which one is the most controllable problem, and which ones also can you help them with. And then as you clarify their needs, what you would do in this stage is help them develop an action plan for coping effectively with that need. And that can include strategies that they'll use, but also it could include making referrals to higher levels of care. And this is something that we'll keep emphasizing, but especially in your role as a manager, and if a member of your staff is coming to you in distress, it's important to keep in mind when doing this practical assistance that you're not necessarily the person that needs to help them develop that action plan. And maybe your role could be helping them figure out what resources are available, or where to ask for more help so that they can get support in clarifying their needs and developing an action plan. Some of the things we want to emphasize here, again, is that PFA is not a one-size-fits-all approach, and gathering this information and creating kind of a tailored plan, the idea is to really develop strategies that are specific to that given person's needs and what they're saying they want, rather than making assumptions about what they might need or want based on kind of either your past experience with them or just generally what you would expect would be useful. But instead, using your active listening skills to really pay attention to what people are telling you that they want, and then working with them collaboratively to clarify those needs and prioritize those needs. And then, like I said, again, really just knowing what resources are available and how to find out what resources are available if you're not sure is really important here. I know Michelle and I have a staff person at UW who we really rely on. Her name is Molly, and so we always say everybody should have a Molly. So she's kind of our wealth of information about referral options, and she's somebody that we know we can go to ask. And if you don't have all the information about referrals in your own head, kind of knowing those people ahead of time and maybe asking some questions around about who you could ask for more help or who you could help get referral information from. The next PFA core action is enhancing connection with social supports. And the idea here is that we know that social support is a big protective factor following traumas or potentially traumatic events. And so what we want to do is help people establish brief and or ongoing contacts with the people around them that can give them that support. So this could include family or friends, broader community members. In the context of a work setting, it can also include their coworkers if those people are supports to them. And this is something that we often need to think creatively about in the context of COVID, but thinking about how, even though we can't see people in person, how we can still maintain our ongoing contact with them nevertheless. And one thing we want to emphasize here is that, we sometimes just think about social support as just people being there for you, but actually there's many different types of social support. And I think thinking about the variety of types of social support and just the diversity in how these forms of support might look, for me anyway, helps me think more creatively about how to get these needs met even during a stay-at-home order or quarantine. So social support can include things like emotional support, so listening to people's feelings, validating their emotions. It could also include just social connection, so just sort of having somebody to check in with, even if you're not talking about emotional things. It can include feeling needed, so giving support to other people is a way to sort of feel connected to the people around you, even if you're not necessarily getting support. It could also include things like helping people kind of get their needs met for assistance or advice or information or material help from the people around them. So it doesn't have to have one form, and there's many ways that people can get their social support needs met, even in the current situation. But helping to clarify for them what's important or what they might need about social support would be a way to help clarify and make a plan for moving forward with that. The next PFA core action is enhancing coping. And at this stage, the idea is to help people get more information about normal stress reactions. And the goal with that specifically is to really validate that all stress reactions following a crisis or a trauma are normal, including having no reactions at all, so being completely numb, all the way up to really having intense distress or panic reactions. There's just a real diversity in ways that people can present, and sometimes for people that are having a reaction that they feel like isn't what they see in people around them, just knowing that it actually is a normal reaction, that other people feel that way, can help to mitigate any additional distress that they might be experiencing because maybe they feel unusual or like they're not coping well. And then after providing information about stress reactions, the goal is to help people identify practical ways that they can cope and reduce their stress and promote their adaptive functioning. And again, I know we've said this a number of times throughout this presentation already, but the important thing to keep in mind is that these aren't one-size-fits-all skills, and the information you give them about stress reactions and suggestions you might give about coping strategies should be tailored to the individual's unique concerns and priorities. There's not just like a blanket set of information that is useful to provide everybody. Okay, so in thinking about some of the coping skills that we talk about, and again, keeping in mind that we would talk about these only if these were needs for the people that we were interfacing with. A big one can be disruptions to sleep. So what we suggest for people that are having a lot of insomnia or aren't getting good quality sleep, first and foremost is to set a regular schedule. So encouraging people to get up at the same time and go to bed at the same time and avoid naps. I think this can be one that's especially hard to adhere to during a stay-at-home order. Just anecdotally, I've heard that a lot of people's sleep schedules have really changed or are really variable from day to day. But of course, we know that that is something that really can contribute to insomnia. So helping people get on a regular sleep schedule is really important. And then also avoiding caffeine, especially in the evening, and avoiding alcohol, again, especially right before bed. People often feel like alcohol helps them sleep, but actually it interferes with your ability to sleep soundly. And speaking of alcohol, another issue that some people may present with is difficulties with substance use. And so the kinds of coping strategies that we would recommend here are helping people monitor and then reduce their use over time. We know that substance use, even though it can be something that, you know, we think of as fairly socially normative, or, you know, if somebody's drinking to deal with a stressful day, we actually know that drinking to cope is less helpful as a coping strategy, and it can interfere with people's natural resilience over time. So what we want to do is help people identify alternate ways that they can cope when they're feeling distressed other than using substances. And then finally, the last thing that we sometimes give coping information about is in relation to physical health. And so as with other things I've mentioned, stay-at-home orders and quarantine and the stress of COVID generally can really get in the way of people's normal routines, especially with regard to exercising and eating a healthy diet and eating regularly in particular. And so when people aren't eating regularly or eating in a healthy way or aren't engaging in their normal hobbies like exercise, sometimes their mental health can also kind of fall off a little bit as well. So we really encourage paying attention to physical health as a preventative strategy to minimize people's vulnerability to distress. And then also in regard to physical health, just finding ways to relax and practice good self-care and thinking creatively about how you can relax, even if you're quarantined with your entire family in the house, even just sort of taking a brief walk or maybe listening to a relaxing podcast, or even just sitting and doing some breathing exercises, but finding those opportunities throughout the day to practice relaxation can be beneficial to people as well. And so what we want to do here with people, regardless of what the needs are that they're presenting with, is to first focus on identifying what has worked for them in the past with regard to coping. So what are their existing coping strategies and strengths in regard to coping? And we do this first and foremost because we think it's really important to emphasize people's strengths and to kind of help them enhance those strengths rather than trying to kind of have them try something completely new if there are already things that have worked for them. Because most likely, even though they might need some adaptation to the circumstances, the things that are already working for people or have worked in the past are the most likely things that are going to help them be resilient in the face of this new stress. So prioritizing those is really important, and thinking about ways to adapt them to the situation. But if all else fails, thinking about potential new coping strategies. So things like taking regular breaks, like, I know that for me working from home, I would have regular breaks built in the office, but just by coworkers stopping by. And so really thinking about having to intentionally take regular breaks during my workday has been really important. This could include things like maybe journaling, if you haven't been journaling before, trying that as a new coping strategy. Keeping a normal schedule, again, an important one when our normal schedules have gone out the window, to kind of find a new schedule that we can adhere to, even if it's just sort of, I'm going to work from this hour to this hour, and then I'm going to take 5 minutes to do something relaxing, and then until 10 p.m. I'm going to spend time with my family. This could also include things like scheduling pleasant activities, like I just mentioned in that example, finding 5 minutes after your workday to just do something relaxing, and committing to yourself to do that every day. So there's a wide variety of new coping strategies that people can try, but we just note these as some examples. And I think we mentioned this, but the slides will be available. So if we've created this as sort of a list, so that you can refer back to this for ideas if you need to. For people that are presenting with unhelpful thoughts, we have specific coping strategies to recommend for that. So we know that people that have thoughts like, I am a total failure at coping, or I am an awful parent, or anything else that is most likely not 100% true and probably is often not very true at all. Those thoughts can lead to really strong negative emotions. And so what we want to do is help people get some flexibility in their thinking and find different ways of seeing those thoughts. And this is one that I think, it's an important role for the people around you to help kind of notice when you're saying something to yourself that maybe isn't super helpful, and helping you think about other ways to look at that. So gentle and curious questions can help gently guide people into seeing those other perspectives without kind of just sort of telling them the other way that they should think. Because we know that when we just tell people what they should think, oftentimes they'll just sort of argue back at you. So things that you can ask people are, what would your kindest self say about this? What are some other ways to look at the situation, or what are some other perspectives? One I like is, if you were to tell, if a good friend were to come to you in the same situation and say that he or she had this thought, would you tell them that that thought is correct? And if not, why not? So again, just sort of helping people gently get some flexibility in their thinking. And then the final PFA core action, before I talk about how to apply this to your role as a leader or manager, is linking with other services. So I already mentioned this a bit at the beginning, but the idea here is to make referrals that are conscious of the bounds of your expertise and the bounds of your role. I think this is especially important to be mindful of in your position as a leader and manager. So what you would do here is help connect people to resources or services to address their current needs as they need them. So this doesn't mean that everybody needs to be referred to therapy or a support line. This would be that if people are saying that they need more support, or they're saying that they're having mental health needs that aren't being addressed, then helping them find those sorts of resources. This also requires knowing what's available and how to connect them to services or who to ask. So like I mentioned, it's important to have your Molly or whoever else in your organization or in your professional network who knows what's available and how to access the services that are available. And then collaborate with them to identify what they need. And then finally, you can offer to follow up and check back in. So if you know that somebody's planning to access a given service, ask them if it's okay if you just check in with them, in a week or two to make sure that it went okay, if this is appropriate. And then if they need any troubleshooting help, then that would be something that you could then provide. Okay, so that was sort of generally the approach to PFA if you were to be doing it with a patient or a client. And so we think of PFA as sort of this big kind of set of skills, but then there's this narrower aspect of PFA that can be used as best practices for support from leaders or managers. And so I'll talk about those next. And so what we want to think about here is that clinical managers and leaders can use select PFA components, including providing just good managerial support. This can include communicating calm, compassion, and respect. So even though you might be having your own kind of intense emotional reactions, kind of focusing on the person in front of you and maintaining that calm and compassion, listening to their concerns, being a place where they can express their concerns as appropriate to their role, but really importantly here, maintaining professional boundaries. So none of us are in a position, obviously, of being our staff's therapist, and it can be tempting when you know how to use these skills to kind of slide into that mode with people, but really emphasizing maintaining professional boundaries and not encouraging people to tell you more than they would otherwise tell you about their personal life in your role. This means also sharing information openly and honestly. So we know that when people are getting accurate and clear communication from their leaders and managers, that can help to kind of reassure them and make them feel like they're included in the process. A lot of what is really hard about COVID is that a lot feels so uncertain. And so being a manager or leader, you're in a position where you can really help to quell some of that uncertainty by being transparent about information to the extent that it's possible and appropriate. And then also helping them troubleshoot challenges, both in the context of their role, including, for example, in their relations with coworkers, they're interfacing with clients or patients, but also if they're trying to, meet their own needs, helping them troubleshoot challenges around balancing that and their work role, or getting access to the referrals that you've given them. And when you're facilitating referrals, it's really important to normalize the need for support. So not treat it like something that's really unusual or that means that there's something wrong with them. And then again, I will just keep emphasizing just knowing the referrals and resources that are out there, or who to ask if you need more information about those. When somebody comes to you in distress, The important thing to do here is use your effective listening and communication tools, which I'm sure all of you have just in the capacity of your role as a leader or manager, but really kind of reminding yourself to put these into place now more than ever. So communicating calm and compassion and respect, both through what you're saying and doing, but also how you're saying and doing it. So kind of making eye contact, and keeping your voice tone really level, really kind of meeting people where they are and listening to kind of what they're saying they need as a way to communicate that compassion and respect. Listening to concerns and maintaining professional boundaries. Again, not pressuring them to share more than they're comfortable sharing, or asking them to share things that they wouldn't have otherwise shared with their employer is really important. This is also really important because of what Michelle said about psychological debriefing, that it is important for people to have a safe space where they can talk about their distress and concerns as they need to, though. So this is not, when people are kind of made to talk about things that are distressing to them, that can often be more harmful than helpful. And it's also important here to keep in mind that as much as you might want to provide support to them, you might not be the most appropriate person to do that. So helping them kind of maintain those professional boundaries for themselves while being validating and compassionate. Letting them tell you what they feel and what they feel that they need, rather than making assumptions about that. Expressing empathy and concern as professionally appropriate. So reflecting back sort of what people are telling you and showing that you have concern for what their concerns are. It's important to expect really widely varying reactions to this crisis and not to judge. So like I said, some people are going to be completely numb and have no reactions right now. Some people are going to have really intense distress reactions. And then there's just so much variety in the middle of those two ends of the continuum. Some people might have some forms of distress and some people might have others. And it really just depends on the person and how they normally communicate distress, and other things like the stressors and their culture, and many other factors. So there's no wrong way to respond to this crisis. No response now means that they're doing a really bad job of coping or that there's something really wrong with them. We expect up and downs, and we expect a variety of reactions. It's important to remain calm yourself, like I said, control your own emotions, and don't rush things, so don't sort of move them faster than they're ready to go. And remember in doing this that you can't take away their pain and you don't need to. So there can be a really strong kind of knee-jerk reaction when you really care about your employees or staff. And I mean, I think probably all of us feel familiar with this concept, that when somebody comes to us in pain, probably our first knee-jerk reaction is to want to take their pain away. But remembering here that you can't take their pain away. So nobody can take their pain away. This is a distressing situation, and it's normal to feel distressed about a distressing situation. And that's not something that needs to be fixed. It's not your job, nor is it anybody else's job to take away that distress in the moment. And in fact, often I think it's much more powerful to recognize somebody's distress and to give people a space where they can feel their distress rather than trying to change their distress in the moment. PFA does give some guidance about how you can respond to distress from individuals in your teams. Keeping in mind here that supervisors are often who people go to first when they're in distress. And you have a really important opportunity to put people on the right path towards resilience and recovery and adaptive functioning. So what you can do with them is first normalize their stress reactions, like I've said. And just knowing a bit about what stress reactions you might expect to see can help with this. So we do expect to see intrusive reactions, which includes the event coming back to mind in thoughts or nightmares, and other kinds of intrusive reminders. This can include avoidance, so attempts to remove oneself from or protect yourself from distress, so avoiding reminders, for example, of what somebody's stressed out about. This could include physical arousal and reactions, which is the body reacting as if the danger is still present. This could include a rapid heartbeat, breathing really heavily, having a headache, having dizziness or muscle aches, and so on. For people that have lost loved ones or have lost clients or patients, they might be experiencing grief in response. And then finally, depressive symptoms are also common. So this would include things like sleep problems, feeling really tired, feeling worthlessness or guilt, and feeling even suicidal or thinking about death or one's own death a lot more than usual. So we want to normalize these reactions as natural and expected and common, and avoid saying things that could be perceived as judgmental or minimizing. And when we'd want to refer people to get more help is not just when these reactions are present, but when they either continue for more than 2 months, or they get worse or get in the way of people's adaptive functioning. So we really want to normalize these. They're not signs of things being wrong. It's only signs of things being wrong if they don't go away or they're getting in the way of functioning. A common strategy that people talk about to stabilize really intense reactions. So this is when, like I mentioned, people come to you in kind of more of a panic state, is something what we call grounding. So this would be people that are having such a strong reaction that it's getting in the way of their essential duties, or it's threatening their own or somebody else's safety, or getting in the way of their healthy coping. This might be a time when this grounding strategy is appropriate, but we really see this as something that's a one-time coping strategy to be used in a crisis, and not something to be used as a long-term coping skill. So what we do for grounding is help the person sit comfortably and breathe slowly and deeply through their belly. Sometimes you can have people put their hands on their belly to make sure that that's happening. And then name 5 non-distressing things that they can see around them, then pause and breathe. Name 5 non-distressing sounds they can hear, and pause and breathe. And then finally, name 5 non-distressing things that they can feel, like the feeling of their clothes on their skin or the chair underneath them, and then pause and breathe. PFA also gives guidance about what information that you might want to gather and how to address individuals' concerns. And you're in a really good position as a supervisor to understand people's challenges and to help them brainstorm solutions. But again, it's really important to maintain your professional boundaries here and balance your efforts to help them problem solve what's in your wheelhouse versus refer out for the things that are not. When we do problem solving, what we want to do is, like I emphasized before, really collaboratively assess and prioritize their needs and concerns, and then choose the most pressing, controllable issue to address, work together to brainstorm all possible solutions to that issue, talk together about the pros and cons of each solution you brainstorm, and then choose a solution together, and then finally make an action plan for carrying out the solution. And there might be situations when somebody needs more than what you can provide. So I know that Michelle and I have both emphasized this throughout, but it is important here to know your limits in the context of your role and professional boundaries, and also your expertise, and to know when and how it's appropriate to refer out for more support. And when we link with other services, when we refer out, again, we want to normalize reactions and the need for help. We want to provide people information and encourage their engagement with the resources, and then ask them what would be helpful as next steps. So just to wrap up before we turn over to question and answer, I want to emphasize that although PFA is a framework for building resilience in the people that you're working with, it's also something that you can apply as self-care. So these strategies are all things that you can apply to yourself and thinking about how to meet your own needs, because it really is important to put on your own oxygen mask before helping others. So thinking about what it is that you need and how you can help yourself address these issues or get more support for them is important as well. So if you have questions about PFA, you can contact Michelle and I at tryheal@uw.edu. You can also refer to today's materials. So these slides and handouts will be distributed, so you'll have access to them. And so you'll be able to access this email address if you haven't written it down already. And we've also created a bunch of infographics to help summarize the main points that we've communicated to you today. So the first of these is a summary of the main kind of concepts of PFA for managers and leaders interacting with staff members, and some of kind of the key things that you'll want to remember. The second is an infographic about when and how you'd want to use coping, so a decision tool for whether or not grounding is appropriate, and then a reminder of how to practice grounding that reviews exactly what I went over in the presentation. And then there's an infographic about helping people cope in healthy ways that includes the problem-solving steps that I reviewed. And it also includes some examples of things that are healthy coping as in contrast to things that are less healthy types of coping. Okay, so now I think it's time to switch over to questions and discussion. So I'm going to give control back.
All right, thanks, Emily. So I see a couple of questions that have come in through question and answer, and I think I hit the wrong button for at least one of those, so I really apologize. We will answer both questions live. But please, if you have other people have questions, please type them into a question and answer. I think I saw one raised hand come up in the chat as well. So if you have a question, you can either type it into the Q&A or after we answer the two that are typed in, we're happy to take verbal questions as well if someone wants to unmute their mic. So the first question we got had to do with whether or not PFA could be done in groups. And other resources or studies regarding PFA in groups. So it's a really great question. PFA is generally designed as something that's done individually, partly because it's got this focus on responding to the individual's needs. That being said, you know, after mass disasters where so many individuals are being impacted all at once, group can often be a really efficient way of reaching a lot of people at once. And so we do know of some people who are trying out a model where they're doing PFA in groups. So our colleague Deborah Kaysen that we mentioned at the beginning, I know she's doing groups with healthcare workers down at Stanford. And my understanding is it's going quite well. I mean, many of the strategies inherent in PFA do translate well to a group setting. I think the key thing with a group that people need to keep in mind if you want to try PFA is around making sure you're still responding to the specific needs of individuals, even within the group setting, because it really isn't a one-size-fits-all. So some individuals are going to need stabilization and coping strategies, while others are really going to need support and resources. And so you really have to sort of make sure that you're able to effectively get at sort of all the different needs individually, even in a group setting. And then I think the second thing is something that Emily and I have both been kind of mentioned or alluded to, which is this idea of processing trauma memories or really emotional memories about exposure to the stressor tends to be very unhelpful in group. So if an individual wants to talk through a memory they have or the specific kind of the specifics about the COVID event that they lived through, that's not to be discouraged, but it shouldn't be done in a group setting. And so it would need to be done sort of individually in some ways so that they could sort of talk about that and process some of those emotions. And the reason it's not helpful in group is really around you know, being exposed to details of other people's traumas can be very unhelpful to people, because then you're not only carrying your own trauma memory, you're carrying someone else's. And that's really challenging, and it can actually make people worse. And so that would be the things that we need to look out for if you were doing PFA in groups. But I do think most of the strategies translate really well. And I think it is an efficient way to reach a lot of people. As far as I know, though, there is not any studies of PFA having been done in groups. The training we did yesterday had some more specifics about actually applying PFA with clients directly. So it went into a little bit more detail than we did today, because today we focused more on how you could support your workforce with the PFA strategies. But that is also a resource, as well as there's online PFA training if you're interested in learning PFA and how to do it with clients directly. So not supervisees, but clients. And we can provide that information to be distributed. It is an online free training for individuals who work in a mental health, like they provide mental health care as part of their role as a leader, if you're interested in doing it with your own clients. Let's see, we have some other questions coming in. Emily, do you want to jump in?
I can take the question about utilizing PFA for culturally and linguistically diverse staff. I think that's a really important question. And the PFA manual is a really great resource for thinking about considerations for cultural and linguistic diversity. And the general kind of concept of PFA, of not assuming what people want and of really listening to them and meeting them where they are, is in part because of issues of cultural and linguistic diversity, that we don't want to be in a position of assuming things through the lens of our culture that don't end up being actually helpful to the people that are coming to us. And keeping in mind here that the PFA was developed for kind of global use and has been used in a variety of countries. And so a lot of this kind of attention to these issues of diversity are baked right into PFA. And so I would really just emphasize, knowing what you know of the person and their kind of diverse perspective, considering just that, their needs and their presenting concerns might differ from what you might assume, and really kind of meeting them where they are and asking them clarification questions and kind of checking your own assumptions, and moving forward based on what they're telling you that they need, rather than any assumptions that you have about what they might need. But like I said, there's a lot of really great resources in the PFA manual, which I believe we've linked to in these slides, but also whenever I'm looking for it, I literally just Google PFA manual, and it's pretty easily accessible online. It's freely available. And you'll see lots of good tips in there as well.
Yeah, and I think the only thing I'd add is, we are seeing huge cultural differences in how people are responding to COVID. Even regions of the U.S., regions of the state of Washington, in terms of different ways that different communities are responding. And so I think what Emily's saying about really making sure you're not making assumptions about how somebody is responding or reacting, but instead really getting it from them, is really key. And I cannot remember if any of the PFA materials are translated into other languages, but I'm pretty sure they are. Emily, do you know?
I believe that they're at least in Spanish, but I could be wrong about that.
Yeah, I think on the World Health Organization site, they have the PFA manual available in at least Spanish, but I might be wrong about that. So we'd have to check that out. But I do think there are some materials out there in other languages as well. I see the next question about, can PFA, from folks doing PFA, give advice? And I would say generally giving advice is not a big piece of PFA. It's really more about helping the person to problem solve, giving suggestions, or giving collaborating on, solving problems is a big piece of PFA. But generally we do try to avoid telling people what we think they should do or what we think would be the best option, because it's really about building up this self-efficacy. It's about empowering people to cope in ways that are helpful to them. So it's really about helping the person figure out what that will look like for them, as opposed to giving advice.
And I think you can give them kind of a range of different options, so help them think about kind of the menu of options. But yeah, giving advice, I would agree with Michelle. It would generally sort of be discouraged for the reasons that she talked about. The next question is about how PFA for managers might differ from using PFA for patients and clients, and how far can or should a manager go with PFA. And this is something that, we talked a lot about as we were developing these slides. And I think to a degree, it depends a bit on the issue that somebody's coming to you with and what your professional relationship with them is. But I think the main difference is that you have to be much more attentive to the boundaries of your role and what's appropriate professionally. So whereas in normal PFA, when you're doing it with a client, you would be asking them maybe some more questions, trying to assess what's going on for them, what might include maybe some personal details, versus as a manager or a leader, you really wouldn't want to be kind of prying into things that they haven't directly told you, just as you probably wouldn't do that in any other circumstance. So really wanting to be a lot more attentive to that, and just sort of keeping in mind that you're still in your role as a supporter or as a manager or a leader. And just as people in your staff come to you with concerns and you help them troubleshoot, that would be the kind of context of applying PFA here. So you're not going to do kind of a lot of like processing of a trauma memory with them. You're not going to do like, helping them pick out all of their unhelpful thoughts and think about different ways to see all of them. But if people are coming to you and saying, I'm feeling like a really awful employee, you can sort of help them think about other ways to see that it's not necessarily, true, or, give your perspective on why they're not an awful employee. And it might include things like, instead of, telling them what the therapy options are, kind of helping them connect to employee-based options for support and services. So kind of helping them connect to things inside your organization. So those would be some of the things that I would keep in mind. I don't know, Michelle, if you have anything to add to that.
Yeah, I think that is the general distinction, is that it really, the professional boundaries of if you are somebody's supervisor really need to be considered. And so, you wouldn't want to be pulling for big personal details. And if personal details were being disclosed, if it started to feel like a conflict, you probably would want to redirect the person, and you'd really be focusing on trying to get them the support they need somewhere else. But just like Emily said, as supervisors, we're often the first line that people come to when they're struggling. And so we want to, using the strategies inherent in PFA around good listening and providing support and normalizing symptoms and shifting cognitions potentially, those are all really places where we can have a huge influence because what we say matters to the people who report to us. They take our opinions pretty seriously. And so, it really is an opportunity to help somebody respond in as resilient way as possible. I do see two questions about who can use PFA. So do we need to have a mental health component to our practice? And what are the requirements for being a trained PFA provider? So you don't necessarily have to have a mental health component to your practice to use PFA with clients. As we mentioned, PFA is designed to be able to be delivered by a wide range of practitioners. So particularly if you have good clinical skills and that you interact with people a lot, you probably can learn PFA and learn the strategies pretty easily and pretty intuitively. And there is a free 8-hour training that's offered by the National Center for PTSD along with the National Child Traumatic Stress Network. That's pretty good. It's an online training. It's 8 hours. I believe it comes with a certificate at the end. It's totally free to do. And you can access that training and kind of learn more of the components of PFA much more in depth than we were able to cover in this webinar. And it's interactive, so you're solving problems and responding to clients as you go through the training. And there is no requirement to be a trained PFA provider. Doing that training is encouraged if you're going to use PFA, in addition to potentially getting some live kind of content like we tried to give today. But really, there is no specific training requirement. It isn't that kind of package. It's very open access for anyone who wants to use it. I will put the link for the training in the chat box. I'm seeing a couple, and that should answer the question for what it's called too. So let me go ahead and do that.
And I can address the question about special considerations for using PFA with individuals coming from historically marginalized backgrounds. So I think I'm hoping that my answer to the prior question about cultural and linguistic diversity addresses that somewhat. But maybe I can talk specifically about the issues with stigma around mental illness. That I think part of what's really helpful about PFA is just normalizing that, there's just such a range of reactions that people can have to crises and disasters, and none of them mean that somebody has a mental illness or even necessarily needs therapy or anything like that. Just emphasizing that most people will be resilient, and these are really normal reactions to really distressing circumstances. I think also just really emphasizing again that we're meeting people where they are, we're not making assumptions, and we're really tailoring things to what they say they need. So if people are coming to us, if they're not bringing up concerns about mental illness, we wouldn't impose that label on them, or we wouldn't suggest that they get therapy if that's not something that they're explicitly saying to us they want or need. And so I think kind of the design of PFA addresses some of those concerns. But again, in the PFA manual, there's a lot of really good specific ideas for each skill for how you can, for kind of considerations that you would have for cultural and linguistic diversity and attending to the needs of people from marginalized backgrounds in particular.
Yeah, and the manual and the training speak much more to how you might use it with children as well. Often when you're using PFA with children, there is a component where the caregiver or the parent is involved. Neither Emily or I work with children. We work only with exclusively with adults, but there is some information in there about applying PFA to children or to families, particularly around how parents can talk to their kids about the kind of crisis, the current crisis that they're enduring, and sort of ways that they can promote coping in their children as well. And then I see one final question. I know we're out of time. We were supposed to wrap up by 2:20, but I see one final question about balancing accountability with PFA. And I'm not quite sure what is meant by accountability. I don't know if you mean kind of like an actual kind of role that you might have in the crisis. So if whoever, Maria, if you ask that question, if you want to write something in to clarify, or Emily, I don't know if you have a take on that one.
No, I had the same question.
Yeah, and if the person can also raise their hand and we can unmute them if they're wanting to pose it live and clarify. Sometimes it's a little easier if they're still here.
I see somebody raise their hand. Let me see how I get that. Okay, I'm going to try to unmute you. I think you are unmuted, Maria.
Okay, hi, thank you.
Of course.
My question is really like being able to balance those problem-solving solutions when you need to hold them accountable to a line that they've crossed, and so sometimes that can feel like you're being over-supportive and just a balance between the two.
That's a great question. Yes, thank you for clarifying. I'm sorry I didn't understand it. That's a great question. So, you know, when your supervisee is actually not doing what they need to be doing as part of their role, and how you balance that, providing them with support while also maintaining job standards that you need. Is that sort of what you mean?
Yes.
Yes, great. Yeah, I mean, I think that is tricky, and I think it's actually a place where I would say that some of these strategies inherent in PFA could be extremely helpful, because those are the people where we really want them to get the support that will get them functioning again. They're impaired a lot, and it's starting to affect not just themselves, but other people as well, right? And so I think, you know, being able to provide them education around how people kind of respond, but then education too around the fact that there are things that can be done to help them cope more effectively, and really connecting them with those resources, and really doing so in a way where it's validating, but also sort of firm, and like, you know, we can do something about this, might increase the chances that they would actually follow up and get whatever it is they need to stabilize, so that, you know, that they could function more effectively. And so I think those pieces around normalizing and connecting with services would be most crucial, and the most crucial aspects of PFA. And so normalizing the acute stress reactions, but also normalizing the fact that when they start to interfere, there are things we can do to help, and really encouraging the person to get those things in place.
Wonderful. Well, those were great questions, and I think we're going to just first of all, thank you both. And we're going to shift into just some quick final remarks, and also keep in touch. You can find out more about us and register for additional resources and training opportunities at our website at www.mhttcnetwork.org/Northwest. You can also sign up to receive our newsletter while you're there. Find us on social media or email us with any questions. We and others also have free self-paced online courses at healthyknowledge.org. We share resources and free training opportunities from across the MHTTC network and other training centers, so you can get all sorts of different training opportunities if you sign up on our website and get the newsletter. And just a final note of thank you. We just really want to say thank you to all of you. Thank you to our presenters, Michelle Bedard-Gilligan and Emily Dworkin. We appreciate all that you shared today on psychological first aid, and we'll look forward to some next steps and on similar topics in the future. Thank you all. Be well, be safe.
Yes, thank you so much for having us. We really appreciate it. Thank you all for your great questions. They were really fabulous. And we hope this is helpful to you and the employees that you support. So thank you so much for being here and for listening. yeah, we just wish you the best for coping. It's a really challenging time for all of us. So again, thank you for making time and for prioritizing this and for being here.
This will help. Take care, everyone.